Good morning, everyone. Fatima and I welcome you all to this series of 3 webinars. This is the last one. We've had very good response and feedback for the first two. I'd like to just quickly let everyone know who's live right now, all the 13, 14 odd participants, that the email has gone out yesterday with the download link for the health and safety plan. Most of them have already downloaded it. But if you've not downloaded the health and safety, the COVID-19 safety plan, I would highly recommend look at your chat box right now, and there's a link for download. Please download that. And it's very easy. Just click on the link. It's a transfer link. Once you click on that, on the left of your screen, you'll see a download button. Just click on the download button and you'll get the Word file right there. And then you can either print that out, annotate your comments while I guide you through the safety plan with a pencil, or if you're a computer person, computer savvy person, you can go ahead and use the Word version and digitally start incorporating the things. The idea is to get you have a draft of the safety plan by the end of the session. And that way you can go and review it with your respective teams and then finalize that as soon as you can. Fatima, over to you.
Thank you, Addy. So I think we have about 1 minute until we go live, but we certainly welcome everyone and thank you for joining us. I hope you have a coffee beside you, and the template is available on the chat box for those that are still coming in. The document was emailed, but it's also available in the chat as a WeTransfer document. If you simply click on the link in the chat box, it'll take you to a download page, and you just agree and a Word document will download for you. So we'll start off in a minute. Before we start, this session is for you. It's informal in a way that we can walk you through a health and safety plan that you will have ready to go by 10:30 this morning. It's a fill in the blank document, and we invite you and your questions in the session through the chat box below, and the Q&A, we will be answering them live and through the chat box for all to see.
Fatima, we are on 9:30. Maybe we can wait for another 30 seconds or so as we see some more people coming in. Sure. And we can get started. And just let everyone know this is being recorded. This session is being recorded because it's a series of 3 webinars and it's the last one. So if you haven't attended the earlier ones, or if some of your franchisees or other restaurant owners or hotels or your colleagues want to know more, or people who are not in this webinar, this will be made available to them through ORHMA. Okay, I just wanted to add.
Thank you, Addy. So firstly, I'd like to acknowledge Keisha in the back. So thank you, Keisha, for your work in the chat box and the links that you're providing. Everyone certainly appreciate your support from 4S. And good morning, everyone. We will start with our session this morning. We're delighted that you've taken an hour to focus on compliance and the COVID health and safety plan that is mandatory and a requirement from the ministry. Today's session is informal in the sense that we want to walk you through a template document that you can just simply fill in the blank. We have our health and safety expert partner with us, Addy Yellapantula from 4S Consulting, who will walk you through the document. So for those who may not know, I'm Fatima Finnegan with the Ontario Restaurant, Hotel and Motel Association, and we truly are delighted that you're here with us today. So with that being said, for those who may not have the document, just one more time, in the chat box, there is a link to a we.tl document. If you click on the link, it's the first link in the chat box. It will take you to a WeTransfer page. You just simply say agree, and then a Word document can and will pop up for you. So we ask that you either have a printed copy of the Word document so that you could fill in the blanks as we go along, and or have the document open on the right or left side of your screen so that as Addy is taking you through the full document, you can fill in the blank at the end of the session, print it up, and then you will be in compliance. So with that said, Addy, we appreciate your expertise and your time with sharing with our members the requirements for the health and safety plan, and I will leave it with you.
Thank you very, very much, Fatima. And it's always been a pleasure teaming up with ORHMA and the lovely set of members you've got. And let's jump straight into the pool, as they say. It's a good time, right, to do that. So yeah, just one quick thing before we get into action. Because of the kind of demand we've had in the first two webinars, we will be staying for about 5 minutes over 10:30. Around 10:35, if you have any further questions or anyone can stay for about 2 or 3 minutes more, we are here to help you with your questions. So let's move straight into the action. Why is OHS compliance significant for employers? First reason, employee safety and your staff safety, no brainer. Next, corporate branding. And wouldn't you want to be called a safety conscious hotel or a restaurant? So that'll be good for your branding, eh? And due diligence, obviously. You need to be in due diligence. You need to comply with the occupational health and safety requirements and to stay open. And what we've done for you is we've got some data from the Ministry of Labor Training and Skills Development for the restaurant sector and different sectors. I will not go through all the information out there, but I'll keep it high level. If you see the top 10 orders issued for the Ministry of Labor under the Occupational Health and Safety Act, there is a section 25 which requires you to take every precaution reasonable in the circumstances. Now, 169 out of the top 10 orders were issued for COVID-19 related infractions. And if you look at the bottom of your table, all of them are for screening requirements, physical distancing, masks, et cetera, But if all these are looked carefully, they are all elements of your COVID-19 safety plan, which is why I'm here today. All of this can be easily tackled through your COVID-19 safety plan. And if you look at the data from the services sector, hospitality and recreation sector, again, 71 infractions out of the top 10 issued were for COVID-19 related orders. And again, 48 of them were for screening, physical distancing, et cetera. So all COVID-19 safety plan related elements. That's exactly what I want to highlight. And when you look at multi-ministry team data for the food services sector, 826 orders were issued for safety plans, which is why we are here. So that will be taken care of. So we are here to help you build a safety plan today. I'm sure most of you have downloaded your safety plan or are in the process of doing that. Let's get started with section 1, COVID-19 safety plan. Let's all jump to page number 1, shall we? And on page number 1, just quick instructions. So this document is a 9-page document. For those who've downloaded it or printed it, you'll see it's a 9-page document. And you can start by printing your company name on page number 1. And there are many blanks, like Fatima mentioned at the beginning, that I will be taking you through when we reach each page. And lots of resources for you to, breeze through and to refer to. One of the best resources you've got is ORHMA, that you're a member of. ORHMA and Fatima have done a phenomenal job of coming up with a website called dinesafe.ca. Please visit that website, dinesafe.ca. There's a video that Forrest and ORHMA created along with the help of the ministry to just support you and guide you on what are the requirements. Please look at all those resources there. Let's move on to page number 1. Page number 1, you will see a business name, completion date, communication date, revision date, safety plan developed by and consulting members. You'll be asking me, oh, lots of information there. Can I fill that up now? So, yeah, at the end, it's a pro forma document. It's a temporary document right now that you're creating. Why don't you take a crack at it? It's very easy to fill up your business name, completion date, what it is today. Just take today as your completion date as a temporary date of completion. Annotate it with a pencil or just put it as a temporary mark there. And then communication date is the date on which you communicate this to your internal and external stakeholders. Internal customers are your own employees. External stakeholders are the government and the public at large. Revision date is when you looked at something in your plan which is not working, when you analyze your plan and you revise your plan. The date on which you do that is your revision date. You can leave that blank at the moment. And then safety plan developed by whoever is developing it, Fatima, Addy, Adrian, John, whoever is developing it, mention that there. Consulting members, they are nothing but your JHSC, Joint Health and Safety Committee members, if your hotel or restaurant has more than 20 workers working for you. If it's 19 or less employees, then you might have a health and safety rep. That's your consulting member along with your managers, supervisors. You can just annotate names there. So I'll give you about 10 seconds to fill this out, and then we move on further on this page. The whole idea is try and get as much in today so that you can review it with your respective team members. Let's move on to the key elements. Now that you've got your title and everything in place, the cover page is sorted, right? Let's jump straight into the key elements of a COVID-19 safety plan. If you look at the three key elements, screening, communication, and control measures. And if you go back to those slides I just showed you, all the infractions, the top 10 infractions for COVID-19 orders issued were all for these elements of health and safety, COVID-19 safety plan. And by the end of the session, you'll have one right in your grasp, which you need to just review and amend and customize business requirements. Let's jump straight to page number 2. I want everyone to be on page number 2 right now. Page number 2 is all about screening. Screening is a simple process where you ask a series of questions, and yeah, it's those set of, I call it the boring questions, like where have you traveled in the past 14 days somewhere, and all those COVID-19 screening questions, but they are required. So that's the process of screening. But the important thing I would like you to note is for your industry, that's the hotel and the restaurant industry and the hospitality industry, you do screening of 2 categories of people, staff members and customers. Let's look how you do it in page number 2. Let's start with your staff members. This section, I hope everyone is on page number 2 right now. In this section of your COVID-19 safety plan, you talk more about your staff members, how your staff members will complete the COVID-19 screening tool for workplaces, and then send it to their respective managers or supervisors before their shift daily. Now, the key thing for you to note here is manager or supervisor, accountability. Who is accountable? Neither can I decide nor Fatima. It is you who can decide whether you want it to be a team leader who does it, a manager, a supervisor on duty, or a senior staff member, your call. Ensure you put someone, make someone accountable for gathering the information related to screening from all the staff so that you have record of that. And then whoever that person is, make sure that they ensure all staff members have filled that out on a regular basis. What's the use of having a screening tool if your staff members are not filling them out? So there has to be, that's where the due diligence comes in. So analyze whether it's being filled regularly, and make the person accountable for storing the records, because you need to keep the records for 30 days. It's because God forbid there's an outbreak or an exposure or a potential exposure. Public health will come in, the Ministry of Labor will come in, and they might ask you for backtracked or backdated data for the last 30 days for contact tracing purposes, okay? And then ensure that your manager or supervisor on duty will, get all the work-related visitors screened before they commence work. Once you do all of that, Dash will ensure all screening assessments related to work will be maintained. Okay, Addy might be the person who actually does the screening. However, Fatima could be the person who's maintaining the records of screening. Or it could be a name of a person, or it could be a position. You can say a team leader does the screening, but a manager does the maintenance of records. So once you do all of that, then your screening requirements for staff members of this part of the health and safety plan, the COVID-19 safety plan, is taken care of. I'll give you another 10 to 15 seconds to absorb this page and try and identify who is accountable for what. While I do that, I do see that there is a question, and I'll get Fatima into it as well. It says, does the COVID-19 safety plan have to be exactly in this format? I think I can take that question. Also, do we need to put names for who is responsible for each task? Excellent questions. I'm so happy you put this question. This is something that I wanted to set the tone, and thank you so much for allowing us to set the tone for this. COVID-19 safety plan, there is no one who says, including the Ministry of Labor, Training and Skills Development, that it has to be the format. The format can be anything. This is just a guideline. Now, instead of you trying to lurk in the lurch and try and find something and manifest some time which you don't have right now in a busy schedule, we've come up with this format for you to make life easier for you, so that you don't need to, the wheels right in front of you. All you need to do is just ride the car, as simple as that. So that's the first part of the question.
Addy, I'm going to add to that point that 4S is an approved training provider for the Ministry of Labor. So because they are an approved vendor or training provider for the ministry, this template works very well for our sector, but certainly it does not have to be this template, but it is one that we endorse as it is endorsed by the ministry. So it does work well, but certainly does not have to be.
Thank you so much for saying that, Fatima. Absolutely. So this is just to make life easier for you. And the second question was the accountability. Yes. Please try and identify, if not a single person for each task. Multitasking is the name of the game. If your managers are willing to do 3 or 4 tasks, it's completely your call. But make people accountable. And the reason we say that is, Fatima, is when the Ministry of Labor inspector walks in for a blitz or a basic inspection of the sector, the manager on duty need not run around in circles or such, who is the person accountable? Where do I get the data from? Who does the screening? You know, you've got everything jotted down. Addy, can I get the screening reports, please? Adrian, can I see your records, please? You know what I mean? That's why accountability is important, but what's more important is sustainability. The plan should not be as good as Addy doing it or Fatima doing it. If Addy is not able to do it, who else is? If one team leader doesn't do it, identify another team leader to do it. And we did get another question, Fatima. What if guests refuse to answer some or all of the questions?
So, and you know, we've had a lot of questions at the association around the escalation of a customer experience. We've had a lot of inquiries about customers who are angry about establishments following protocols and asking them to answer the questions, or to wear a mask, or to put the mask back on, or they're not entitled, to walk on a patio without a mask. And there has been some pushback from some that do not want to, and simply it is a requirement in order for them to enter the establishment. Now, the contact tracing questions are required only for the restaurants. So for that point, they are a requirement. They need to answer them. But certainly if it gets into an escalated environment, there's been a lot of focus on training of how to de-escalate the customer experience, because there is and can be some anger and to that degree.
And Fatima, just a quick addition I'd like to make to your point is, this is where you can be a little more creative as a restaurant or a hotel and try and make life easier for the customers, in the sense, give them a QR code or barcode by email where they can do the screening on their phone while it's sitting in the car in the parking lot, or make life easier for them so that they don't require a person to do it in person anymore. There are ways in which you can do it. Yeah, let's move to screening customers on page number 2. You have done your staff part now. Your COVID-19 safety plan covers how you plan to screen your staff. This is where you cover how you plan to screen your customers. This is your area to identify who would be the person who will be asking customers all the questions. And what a wonderful question we had as a prelude to this slide, actually. So who will be that person? It could be a person, or it could be just a software where you send a link and the person downloads, uses the barcode goes online and screens. It's a very simple way of doing it. There are many easy ways of doing it, but identify who's going to be doing that. That's crucial. And then obviously, if someone says yes to any of the screening questions, then it's completely in your court. The ball's in your court to decide whether you're going to allow the person in, or what is going to be a strategy. Obviously, you wouldn't want your staff or your other customers to be exposed to that person. So what do you do in that? You can mention all of that here. And then contact information of all the guests seated will be recorded and has to be stored for 30 days. As I said, if there's an exposure or if there's a potential hazard or something for COVID-19, when people come in, the authorities come in, they will look in for backtrack data. You should be having that available for contact tracing. Again, sustainability is the key. In case Dash isn't available, Dash will be responsible for these tasks. In case Addy isn't available, Fatima is responsible. In case a team leader isn't available, another team leader is responsible. Make sure that the program doesn't go with the person writing them. Simple as that. You have to ensure that it's sustainable. So this is as far as the screening accountabilities is concerned for customers. I'll just give you another 5 or 10 seconds to just absorb these while I just check with my team if we have any questions, new ones. I don't see any.
Addy, I'm gonna jump in here. The last point here, talking about contact information. In the regulation, it states that we need to acquire the contact information of all the guests who are being seated. There's been a lot of questions about, well, what contact information? So the name is a requirement, as well as either phone number or email. So that if, to Addy's point, if there is an outbreak, that we need to contact them. So it's how would you contact them should there be a case tested at the establishment. So most are doing either phone number or email.
Absolutely. Thank you so much, Fatima. So let's now move on to page number 3 and 4 of the safety plan. We'll start with 3 and transition to page number 4. So both these pages deal with communication. Communication has 2 facets: internal and external communication. Internal refers to the communication with your staff and clients, and external refers to your communication with the external public at large. And it could be through websites, digital media, digital marketing, etc. So let's now move to page number 3, everyone. And I hope you're on page number 3. And it is something where I cannot do anything. It's all in your court. Lots of fill up the blanks, and I'll take you through each one of them. Internal communication. This is a part of your COVID safety plan where you show to your team as well as to your customers, to everyone who wants to review your plan, who will be the person who will be emailing your safety plan to your staff. Will it be Fatima who will be emailing the safety plan to your staff, joint health and safety committee members, workers, etc. And if Fatima does that, Addy will post the updated information on the staff bulletin board. Keshav will be the person who is a digital marketing expert who will update the website and the social media handles to ensure that the external customers see your COVID-19 requirements for guests to come and enjoy a wonderful dining experience or to feel more hospitable. And then who will send the weekly reminders, monthly reminders, etc. Fatima could be the person sending it. Adrian could be the person keeping all the staff members up to date and responsible. And someone else, let's say John, is responsible for a change in updating any changes in contact details or any essential information. So I'll give you about 10 to 15 seconds to reflect on who's going to do what, and understand that this is a very critical aspect of your plan. And where this comes in handy while you're trying to fill this out, let me tell you, is it comes in handy when you're evaluating how effective your plan is. So you don't need to run around in circles. You can just go to Fatima and say, Fatima, how was the emails going through? Are you comfortable? So Fatima says, I'm using a software called Campaigner. That's not working well. I want something like MailChimp to give me more options for emailing. You can sort that with her and to reach better. And then how many people are opening the emails and other things. And that way you can check with Keshav how many people are watching these, how many guests are replying to our social media posts and other things. So that's where this all comes in handy. And we do have a question which says, do we have to document that each customer answered no? And do we have to record the person sitting or attending the restaurant? So do we have to document?
I'll touch base on that. So the question of if they answer no to the contact tracing questions, yes, we need to document that. On the who do we get the information from? We need to record the contact information for every patron that comes into the establishment for the purpose of eating a meal. If the customer is coming into the establishment for a takeout or for a curbside pickup, the contact information is not required because they're using the time lapse of 15 minutes. Even if someone is coming to the restaurant to drop somebody off onto the patio and then leaving, their contact information is not required. I also had a very interesting question at the last session, after the session, Addy, about contractors who may come into the hotel. So if the elevator at the hotel breaks down and the elevator repair guy comes in, do we need to acquire any contractor's information that come into the hotel property? And the answer is no, we do not need to acquire any service people that come in to fix our equipment or such. We do not need that.
Thank you very much, Fatima. So that was great information. Let's move on to page number 3 of the safety plan now. Now that you've filled out how you're going to communicate your safety plan with the internal staff, this is just a quick information update page where you just identify quick people who are accountable. Addy will be the person who will be checking with the government. That's the official Ontario.ca website for information updates every Monday, because always remember, you need to look for updated information because this information keeps changing very fast. It's very dynamic. So the screening requirements might be different, maybe a month later. So just keep on it, make Addy the person responsible for that, and then make Fatima the person accountable for ensuring all the COVID-19 information is gathered, and that's understood and forwarded to the right people in the office. And could be a manager, could be everyone. And then identify who's going to be the person who'll be sharing all this information. It's very simple. Addy does the first part, gathering information. Fatima does the second part, understanding and making it more readable and sending it and sharing it to everyone. So I'll just give you another 5 or 10 seconds to reflect on this, and then we can move quickly on to the next slide. So now that you've filled out that part, how will you train your staff members? Training is a very, very crucial element, because training helps you make your staff aware of the hazards and possible potential exposures. And how are you going to do that? This is the part of your safety plan where you can demonstrate what you're planning to do and how you're planning to keep your staff safe, how you're going to train them on the proper PPE use, that's a personal protective equipment, hand washing techniques as per the government guidelines. How are you training them to identify symptoms, to stay at home and observe themselves in case they have any symptoms, and how do they report that to their managers, and how their managers keep track on them? And then how do they track COVID hotspots? How do they comply with mandatory screening requirements before every shift requirement, and how they're trained on infection prevention, disinfecting, etc. The most important thing is provide your staff with all the important resources. dinesafe.ca that ORHMA created is one of a very good resource that you can use to keep yourself up to date. Ontario.ca, and then many other websites of the Public Health Canada, that to keep yourself up to date on the information. And this is crucial because unless you train your staff and they know what they need to do, and who is accountable for what, they're not going to feel safe. And this is your opportunity to make them feel safe. I'll give you another 5 or 10 seconds to assimilate how you plan to do your training part and who's going to do what. And in the meantime, Fatima, do we have any new questions coming in that we can take right now, or can we move to the next page?
I have one that I'll just be reading and responding in a moment, but I did want to talk about the video that is available, and it talks about how to reopen. Just like when takeout and delivery was available, we had to help operators understand how to do takeout and delivery in a safe format for not only the customer, but for our employees as well. And the video that we put together was to help every restaurant open safely. And it touched upon best practices and requirements in the regulations, but also with the Employment Standards Act, which was very important to share. And the video is available at dinesafe.ca. And it is it's about 15 minutes in length, and it certainly is helpful. The video that 4S has put together in conjunction with ORHMA and the ministry. So it is available to everyone through the dinesafe.ca website.
Thank you very much for that, Fatima. And before I just move into this page number 4 of the safety plan, there's one thing I'd like to add, and it's important, is training, screening, and all these aspects of the COVID-19 safety plan are something crucial for you. It's because you have a very big responsibility of not just keeping your staff safe, but it's also the customers and the community at large. We've had enough of the waves. Let's enjoy the waves in the ocean out there. Let's enjoy the waves in the lake, and let's not have any more waves, and let's all work together. And that's why we're having these sessions. When we have a plan, when we train our people, we will fight hard to ensure that we don't get into another wave. And we'll ensure that we'll try and see how we can keep each other safe. And this is about COVID-19 has taught us how a community gets together and helps each other. Let's move to page number 4 of our safety plan. External communication. You have done your screening now. You've shown your staff how you plan to do your screening. You've shown your customers how you do the screening. You have done your internal communication. Now let's understand external communication. This part of the safety plan is where you demonstrate how you plan to communicate your COVID-19 protocols and your safety protocols to your customers and to your public at large, to authorities, to everyone. How do you plan to do that? I, for one, would definitely look into the social media handle of a restaurant or a hotel before I go in. So just to see if they have any special events or something nice that they have to share. So who's going to be the person accountable for updating that information? Will Addy be the person updating all the public health information that's required? And will Fatima do the periodic sharing of information and newsletters with your customers at large? And who will be the person who will be updating your social media handles and website? Identify the people accountable. That is crucial. Health and safety is not just about doing everything right and staying in compliance. It's being in compliance. It's about staying in compliance. How do you stay and how do you remain in compliance? One of the best ways is have people accountable. At the same time, have plan B. If a team leader is not able to do it, who is the other person? Will it be another team leader or a manager? Clearly have your accountabilities defined, and this is where you do it in this part of the plan on page number 4. I'll give you another 10 seconds and let's quickly check if there are any questions. There are none. So once you have an idea of the external communication on page 4, let's move to page 5 and 6 of the safety plan, which has got to do with control measures. Now that you've done your screening and your communication, okay, here's your time to control. How good your plan can be will be defined by the way you plan to control the hazards and ensure you keep your workers safe. Control measures are all your hierarchy of controls that you will be applying. And let's dive deep into page number 5. I would request everyone on this call to move to page number 5, where it talks about control measures and physical distancing protocols. If you look at all the fill up the blanks and all the bullet points here, they will refer to some hierarchy of control or some level of control mentioned in the hierarchy of controls. It could be an engineering control, it could be administrative, it could be preventative, it could be a reasonable control. The idea is, if you want to know more about these hierarchy of controls, like Fatima said, the video would be a very good idea. Do visit dinesafe.ca and have a look at that video. It has got a lot of information on different hierarchy of control and what you can do with that. Who will be the person responsible to ensure all barriers are installed at the cash counters? Again, it's all about accountability. Addy will ensure the barriers, but Fatima will ensure the barriers are repaired. What's the use of having a barrier if a naughty child can sneak through? So you should be very cautious that the barriers are working properly. Whoever does the first part, there has to be another person or the same person, maybe it's up to you completely, or a position to ensure that it's repaired and inspected well? Who will be the person who will ensure all the physical distancing markers will be well painted and clearly visible? And who will ensure they're repaired? Because you do have them, but there's rain out there, bad weather sometimes, the markers go all over the place, they need to still be visible. Who will be the person who will be taking care of ensuring the painting and other things? Who will be the person ensuring that your staff is taken care of? And good questions are number of tables. How many number of tables you'll install? Again, it all depends on capacity requirements and the government's guidelines on how many people can, enter your hotel. So it all depends on those things. So you need to take a call based on that. And how many people will be seated on a table? Good question. You need to decide based on your protocols and how to keep them safe and how to keep your staff safe. That's how you do it. And then how many people enter the hotel, how many people sit and dine in, or how many people use the takeout process, and make it sustainable. If plan A doesn't work, who is the person accountable or a position accountable for doing the other part, for doing the same parts? So what I'll do is I'll just give you a quick 10 to 15 seconds to reflect on how do you plan. Ask yourself, how do you plan to control exposures for COVID-19 at your workplace? Who do you think could be a person accountable? If you feel someone who's a team leader that does it, jot down the names there. It could be a temporary name. You could change that later on, but jot down those names so that at least you have a plan ready. Let's move on to page number 5, the same page, and continue with the COVID-19 control measures. Here, you just say how many people in total will be allowed in your patio. Crucial. People are loving. I myself, oh my God, when I look at a patio, I'll jump into the hotel right now. That's the kind of mood people are in. However, you need to also ensure that you don't have so many people that you make people sit on the table. So you need to be careful. Just identify how many people you want seated at a patio at a time to ensure they're safe and your staff is safe. And then how many times you're going to hold your staff meetings while following social distancing protocols. Crucial. If you're holding a staff meeting, physical staff meeting, how are you planning the social distancing protocols? Will it be a team leader who will ensure that everything is taken care of? Just reflect on all these things. And then all the staff members will be required to wear a mask, but who's going to be the person accountable to ensure that they're doing that? Will it be Fatima? Will it be me? Or will it be Adrian? Or will it be a position, team leader or whoever? Have a person accountable. And the good idea is keep the menu touch-free, in the sense QR coded menu. So I'm sure most of you are doing already, just an FYI. That's one of the easy ways of removing the touch points. As many touch points as you can remove, the better for you. And then who will ensure all the tables, chairs, and payment machines are sanitized? There needs to be someone. Again, train them in safe while they do all the sanitization. Critical. There are many trainings available out there, and Forest also has an infection prevention control training. And if you want some more information, right at the end, I have my contact information. Please feel free to get in touch with us. So extra masks and PPE will be stored and provided to staff members if required. Ensure you have stocked enough of masks and PPE to ensure that if a staff member has forgotten a mask, you have one available. And this is where you have your hand sanitizing stations. So basically, you're setting up your controls in place. You've done your first part of the control. Now you're doing the other part of the control. You're identifying people. And let me do a quick check on any questions at the moment. I do see a few questions, and Fatima can get back to me if there's something that can be taken right now. So I'm just giving you another 5 or 10 seconds. There is a question that I see. It says maximum people at a table is a wide open question. Just need to be social distance. Fatima, what do you think? This is a question we've been asked on virtually every webinar, and I don't blame anyone for asking this question. Again, it all boils down to how you think your customers are safe and your workers or staff members, hostesses, waitresses, waiters, waiting staff, they're safe. at the end of the day, that's all that matters. And it's come to a stage, Fatima, that people are beginning to cooperate with everyone because they've realized that the effort is mutual. So would you like to add something on that?
Yeah, so for the limit on the number of people, it is wide open. So if you do receive a reservation for a table of 10, you can sit the 10 people at the same table. It is unlimited. There is no requirement in or restriction within the regulation other than the capacity limits. So we do need to respect the 6 feet apart and the capacity limits for indoor settings. So for indoor event space, for instance, is limited to 50% capacity to a maximum of 1,000 people. But the establishment needs to configure the venue with the 6 feet apart from person to person, not table to table. And then again, there's no limits to the number of people seated at a table. This indoor setting does change when you throw dancing into the mix. Indoor events with dance facilities being used are limited to 25% capacity to a maximum of 250 people, or whichever is less. And that certainly depends on what your occupancy load is for your establishment. And again, your establishment needs to be configured with the 6 feet apart from patrons sitting at different tables. And again, there's no limit to the number of people seated at a table.
Thank you so much, Fatima. I think that answers the other question we got, that saying someone's getting requests, the industry's receiving requests for larger groups, celebration of live events where clients wish to have 30 plus people. Is this allowed and in a group setting? So you've answered that to a large extent already.
Yeah, I think what I'll do for the those that are asking questions about larger events, I'll put a link in the chat or in Addy, can they see the links through the Q&A box as well?
Yeah, you can put in the links there. Yeah, absolutely.
Okay, perfect. So I'll put in the links there for everyone to understand a little bit more around groups. There's been a lot of questions around buffets, as well as for hotels that offer breakfasts in the lobby. I'll put a link, 2 links for you that will help answer those questions with charts that we've actually put together.
Thank you so much, Fatima. Let's move on to page number 5 and 6 of the safety plan, which talks about training and communication. Again, it's all about accountabilities here. Just simply identify who will be training your staff members on proper use of PPE. Someone's going to be cleaning all the touch points, like the POS machines, the payment, the point of sale machines, and then the desks and other things. So ensure that they're trained and they have the PPE that they're using. And then who will be ensuring all the staff members will be working, wearing all the masks and PPE. Identify who that person is. And then who will be the person who will ensure all disinfectants are used in the premises are approved by Health Canada. Well, I'll narrate a very funny one. I did go to some places where I saw no label on it, on a sprayer and sprinkler, and then people doing that, and I would not recommend that. So you would want to have a label, and that's a WMIS requirement. And on top of that, you would want to know, and the person using it, that's where the training comes into play, needs to know what's there, what's the chemical there inside that, and then how to use it to ensure that, yeah, in the safest way possible. Please ensure that happens. And then informative posters all over. It's been posters galore, Fatima, wherever I go. They don't leave us even in the restrooms nowadays. So you have posters informing people doing what they need to do to keep themselves safe. Try and give as many keep as many informative posters that you can to keep your staff and your customers well informed. And opening manager needs to ensure, you can mention that opening manager needs to ensure all windows and doors are open before service, because ventilation becomes a very key factor, especially with the variants. So ensure that you have a very good handle on that. And the closing manager should just ensure that all that is left open and overnight. And then if they're not doing it, who else can do it or needs to do it? Because that needs to happen. That can't be people dependent. If Fatima is absent on that day, or Fatima calls in sick or says she has symptoms, or Addy has symptoms, Who else will be the person doing it? Will it be a team leader? Will it be a manager? Identify that. So I'll give you another 5 or 10 seconds while Fatima can skim through the questions and let me know if there's something pertinent to this slide that we can take. If not, we'll quickly move on to the next one, but I'd like you to reflect on this. Now let's move to page number 7 and 8, everyone. COVID-19 case management at the workplace. You have done part A of the plan. You've done your screening. You've done your communication protocols. You've mentioned what your screening protocols are, your communication protocols are. You've mentioned who's going to be doing what, okay? And you've mentioned all your control measures. How are you planning to manage a COVID-19 exposure is what we're going to be looking at in page number 7, everyone. Shall we move to page number 7, which talks about procedure to handle illness at a workplace. So this is your part of the plan where you just tell your staff members, managers, and all the key stakeholders of how you're going to get a handle on this. Okay, so in case your staff member feels unwell, who's going to be the person who's going to be informed immediately? Will it be a manager, team leader? Identify that. And then obviously if they're having any shortness of breath or if they're unconscious, make sure you call 911, that's a given. And the staff member feeling unwell should obviously go home or either to a doctor. That's a call the manager can take and the staff member. The important thing is there has to be an area of isolation. Identify an area of isolation where the staff member complaining of a symptom or feeling unwell can actually wait until their ride is out there. Until they get their ride, ensure that they're in a safe place where they'll keep themselves and others safe from exposure as well. That's an important thing. And staff members providing help. Now, helping is important, good. Teamwork is great, but ensure your people are trained in helping. For example, if someone has to give someone a first aid, you need to be trained in first aid, as you know. You can't be doing that. And if you're helping a staff member or your teammate, ensure that the person is wearing all the proper PPE, or guide them if someone is someone who's feeling unwell. This is the protocol that we need to follow. If you need to help them, you need to do A, B, C, D, E, and who's going to be the person accountable for that. Affected areas must be sanitized. That's a no-brainer. Again, train the people who are going to be doing that because they are going to be having potential exposure issues. Ensure that they have their PPE in place and everything, then you're good. So as far as this page is concerned, we're good. I'll just give you maybe on 10 seconds or so while I see Fatima smiling because there's a question that has impressed Fatima there. So Fatima, we can take the question while we move on to the next slide. Yeah.
Yeah, so I'll jump in, and I'm excited with all the questions because it really proves how warranted interactive webinars work well. So thank you, and keep the questions coming. We are monitoring them on both the 4S and the ORHMA side. I just wanted to let you know that in the chat box below, just click on the chat box. I've put in 2 links for everyone. One is a link that'll take you to meetings and events summaries. And in this document, we've actually put information specifically to capacity, to music, to buffets, as well as to the limit reminders for nightclubs, for hotel facilities, especially for the fitness areas. And I've also put in a link for meetings and events and step 3 information. And that talks about indoor setting, outdoor settings, talks about dancing, it talks about music, and it also talks about PPE. And there is some information on contact tracing there as well. So those 2 links in the chat box, the last 2 links in there, are available to you. So if you click on them, it will give you a summary guideline that we put together for industry. Now, if we could talk about PPE for a moment, because Addy, this question comes up every day with confusion about masks, about face shields, and about people like Addy and I who both wear glasses, although his might just be for distance and mine's to see the screen up close. The requirement is masks for all, and the eyeglasses are not considered eye protection. Now, I do have to make a note here that we do have 34 public health units in Ontario, and we do have one provincial regulation. The provincial regulation is superseded by the public health unit requirement. So we have had some members in some areas where they have not had staff using face shield, but the public health unit in the region did require it. So the rule of thumb is if you are exposed to a customer more than 15 minutes and you are closer than 6 feet apart, they are required to wear a mask and a face shield. And the same does apply for kitchen staff. And this has come up many times where kitchen staff that are not able to keep the 6 feet apart are required to wear the face shield as well. And again, the eyeglasses are not considered as eye protection.
And I'd just like to add to that, Fatima, is the reason is it's all because of the variants. No other reason. Because eyes are becoming a primary point of exposure and entry for the virus. That's it. So let's not.
And I think in the last webinar that you did with the ministry, when you had the chief prevention officer in attendance, he had mentioned about the droplets, and it was mostly because of the variant droplets are finding the eyes as a socket of connecting to make a connection. So
Correct.
that is the reasoning there.
And the very less droplets required for the variant to actually infect a person. Absolutely right. Thanks for that question. So it's a very tough question, but let's move on to page number 7. Steps to handle a COVID-19 confirmed case at a workplace. Very simple. You've already now got into a habit of accountabilities. I'm sure I've got you into the habit of getting people accountable. Here you have a person, Fatima. Did you inform all the public health unit about it and seek some guidance from them on what are the next steps? Addy, did you complete the workplace accident report? Adrian, did you fill out the Ministry of Labor Training Skills Development report? Did you report to the MLTSD and the WSIB? That needs to be done within 3 days. You better do it now. And John, did you inform all the staff members via email that unfortunately we have an exposure at our workplace? So that's as easy as that. Now, why I said that way is to let you know that's exactly what you'll be doing when you have an exposure. So you don't need to worry about, who's responsible for this and running out in circles. No, you'll know exactly who's accountable for what. And then when you measure the effectiveness of your plan, you just go to Fatima to ask her, how is this communication working with the public health? Do you need any help? Addy, how is it working in terms of the report? And yeah, that's how you improve your health and safety plan and revise them. Let's move to page number 7 and 8, where this continues. And again, it's just about informing the public health authorities who's going to be doing that. And if someone's recovered, then what are the public health requirements that you need to follow, and who's the manager who needs to keep a track on them and need to be in touch with them. Identify those people and then keep them in good mental health. It's about teamwork. A person is going through stress already for the last year or so because of what the world has gone through. Now that the person is tested positive, it is your duty as an employer and more importantly, as a Samaritan or a citizen, or even as a human being, to keep a person mentally strong and say that we are with you, we'll stand by your side, and give them all the energy, the resources that will help. Dinesafe.ca has some wonderful articles I did see. And then there are many good articles on the internet on mental health to keep yourself up and running during the 14-day period or the quarantine period. Ensure someone is in touch and you make the staff feel wanted. And then if one person is not available, who is the other person doing it? Ensure there is sustainability and the program doesn't walk away with the person who's responsible. Let's go to page number 9, everyone. Measures to handle additional risks or hazards. Again, lots of fill in the blanks. It's all about accountabilities. This is where you tell your staff members who's going to be the person in charge of the training and updating the safety data sheets, Who's going to be doing that? That's crucial because someone needs to do the cleaning and the disinfecting work, right? So who's going to be doing that? And then who will be the person ensuring all the lighting is proper? It's all good to have those dim lights. Fatima was talking about dancing. Oh my God. The hotels are all open, the restaurants are open, the nightclubs are open. So when you dance around, dim lighting is good, but is it hampering your staff members from actually seeing each other? Is there a hazard that they're potentially facing because they will be wearing face shields and other things like Fatima said, eye gear? Consider all of that and this part of the plan. And then ensure periodically you check with your staff members if all these things are working, and more importantly, how mentally strong they're feeling, how good they're feeling. Are they in good space? Don't be afraid of asking them. Think like a proper human being. Think like a Samaritan. Ask them, okay, are you mentally strong right now? Do you having any mental issues? We are there to support you. You're our team member. You're part of the family. Tell us how well you're feeling right now. We'll try and do whatever we can to support you. There's a good resource for mental health. That's www.hospitalitystaystaystrong.com. Hospitalitystayststrong.com is a website you can go to. I'll get my team to type it in the chat box so that you can visit that and read more. Keep yourself well informed and trained. Again, if A is not available, who is the other person doing it? Have that in mind.
Addy, I'm just going to add to the hospitalitystayststrong.ca. This was a portal that ORHMA put together because we were very concerned about the mental health of our employees when the pandemic hit last year. We partnered with CAMH and we ran different webinars with occupational therapists on mental health, not only for the employees, but also for the employers. And then we had a webinar on how to move worry and stress and how to live daily with moving some of the stresses that we are all living through. As they all say, we're all in the same boat, but we're all in a different, we're all in the same storm, but we're all in a different boat. So certainly the hospitalitystayststrong.ca portal is available to you with recordings of the webinars, but also downloads. And there is free internet therapy available that the government has extended out to Ontarians that is available on the website.
Thank you very much, Fatima. And I'd like to say that positivity spreads like virus. Positive energy is very, 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 very important. If someone's a very positive speaker in your team, ensure your positive energy rubs off on everyone, because the more you spread the positive vibes, the better during this time. Well said. Safety plan effectiveness, everyone. Page number 10, please. You've created a wonderful plan. It's all done. You've got a nice record signed off by everyone. Good, good, good. It's communicated. How good is it? How good it is? It is as good as it is executed. So if you execute it well, and if you implement it well and measure its effectiveness, that's when you understand how good your plan is. So this is your area where all those accountabilities come into play. Very simple. Go to Fatima, ask her, how is this, the control measures going around with, working with the staff? Are they happy? What's the feedback you're getting? Work on that. And encourage your customers to share their feedback as well of how they're feeling about your safety protocols, which will help you brand yourself as a safety conscious hotel or restaurant as well. And then seek inputs from your health and safety representative or joint health and safety committee member. Don't be afraid of asking feedback. Don't be afraid of getting, there's nothing called negative feedback. There's everything constructive. Build on something that you get. Improve your health and safety protocols. It's all about keeping your workers and staff safe, both physically and, like Fatima said, maybe even more importantly, mentally. Keep them mentally and physically safe. So again, if A is not available, who is the other person doing it? B. Will it be a team leader? Will it be a supervisor? Identify that. Here are some important links. I won't waste too much time on this. This is there in your plan on the page that we are on right now. It clearly lists out all the important links, and Fatima will be sharing all of this with you any which way, including this deck. Okay. And dinesafe.ca is a good resource, and hospitalitystayststrong.ca as well for the mental health. Let's move to safe restaurant reopening protocols. Again, It needs no interaction. As an employer, you have an obligation under Section 25 EH that you saw at the beginning to ensure all your workers are safe. And all you need to do is understand how COVID-19 spreads. I'm sure most of you would know it by now. Obviously, most of the world knows that it's person to person or surfaces to objects. What are the key risk factors for COVID-19 transmission? Prolonged exposure, close proximity, crowded places, closed spaces, forceful exhalation. That's why all the PPE, that's why your COVID-19 safety plan to stay open. So you do all of this, you're open, you're safe, and your business is up and running as well with smiles on everyone's faces. Hierarchy of controls. In your control measure part, identify how you're planning to control the hazard exposures. Are you planning to eliminate the hazard, use substitution strategies, or engineering controls, administrative controls, or PPE? Like what I mean by engineering and administrative controls is are you using plexiglass barriers? Are you planning to use staggered work shifts for your employees, or restricted areas and isolated areas? It's all part of your control measures. And if you need more information on this, please visit the dinesafe.ca website, which is mentioned there. Okay, it has a video that ORHMA created along with us, will help you and guide you on all these details. Personal protective equipment are nothing but all those that you wear and use to minimize your hazard exposure. Very simple. Train your staff on using the personal protective equipment. All you need to know about PPE is it helps you prevent the exposures, but someone using it for screening and other purposes needs to be trained on how to use it. And they must be used alongside control measures that you already have in place. And all the PPE that you use must be in working condition. You must not have masks eaten up by rats, as I say. Yeah, or you must have, and you must ensure all the barriers and whatever you're using as a PPE, vests, everything are in good condition. And it's recommended that your staff wear masks as much as they can. And Fatima has already spoken about that, but know that you are obligated as an employer under the OHSA, which is your Occupational Health and Safety Act, to protect your workers. And regarding the Occupational Health and Safety Act is very simple. You need to protect your workers under Section 25. You need to have written safety plan under the Reopening Ontario Act. You are open under the Reopening Ontario Act. If you're open under the ROA, you need to have a health and safety plan, and you already have that. You're working on that, so good. You're all set with your health and safety plan. Now, just communicate it with your workers, unions, supervisors, determine who the key stakeholders are, communicate it with everyone, work on that. And then all this will just ensure that you have very clear COVID-19 safety protocols in place. You post them in common areas. Let your staff know, not just your staff, let your customers know your safety protocols. Okay, when they see your safety plan, they say, oh my God, what a good hotel. I'll give them a Google review. I felt so safe going there, and the food was awesome. Icing on the cake. So wouldn't you want nice Google reviews like that? So this is one of the easiest ways to build a strong customer relationship and branding. And how do you manage a potential case? Very simple. You manage a potential case by following the steps right in your screen. Again, it's all about accountabilities. Fatima, have you done this part? Have you identified the symptomatic person and done and excluded them? Have you contacted public health, Addy? And have you followed these directions? Very simple. This is your part of the plan where you analyze how good the plan is. And here's some help and other related information that you might require. And it's there in the slide, which will be shared with you, and it's there in your plan as well. And FORAS, like Fatima said, is the official health and safety partner of ORHMA. So we are an occupational health and safety consulting, training, and technology company. So during COVID-19, we recommend you to look for safe and cost-effective training options. So if you're looking for something like Joint Health and Safety Committee training, we are CPO approved for e-learning. That's a 15 hours of e-learning, saving 1 day, which is earlier 3 days. And then you can do part 2 again through virtual learning. If you need more information on this, or if you need more information on how to prepare a safety plan or any consulting support, FORAS is out there to help you. With this, I end the webinar and pass it over to Fatima.
Wow, Addy, there's been a lot of information today. So thank you, and hope you have some water beside you as we open up the floor for questions. For those that did and ask some questions in the Q&A box, I did put some links available directly to you. So before you sign off in the next 4 minutes, if you could check the links that are available, and we will continue to get your questions that we will answer for you.
There was one question that I saw, Fatima, which says I should have asked this earlier. On the screening section, it says if clients say yes to any of the screening questions, they might not enter the premises. In our case, as a hotel, we're accepting guests we know are self-isolating. Good question. Again, we told you it's business to business basis. You decide what you need to do to keep your workers safe. If someone's already said yes to a symptom, or if not a symptomatic question, let's say they've traveled outside of Ontario, you decide what your protocols are then with that particular customer. But ideally, you have to keep your staff as well as your other guests safe. So that's all that matters. Fatima, you would like to add something there?
Yeah, I think what I'll do is for that question there, I'm going to actually give them a call after the session to get some protocol to answer. I'll make a call out to how do we handle that. And I don't have the answer at the moment, but I'm happy to give you a call after this session, and then we can review what the options are available for that. And you're welcome.
Thank you, Vanessa, for that question. So do we see any question?
And I hope this format was helpful. You know, many times we speak and there's less interaction. There was really good interaction today with some very good questions. And if you continue to have any questions, please put them in the box, because you may not be the only one with the question. And then when you ask it, someone else goes, why didn't I think of that? So certainly if you have a question during these times, health and safety related or to the safety plan, please let us know. We certainly are here to help and assist.
Yes, Fatima, that's the whole idea. And I did leave my information there already. In case maybe I'll get my team to type in my email ID in the chat so that everyone can have access to it. We are here to help you. At the end of the day, if you require any support or any guidance or further guidance on occupational health and safety requirements, Forest is a CPO approved provider, Chief Prevention Officer approved provider for Joint Health and Safety Committee training. And not just that, we are ISO lead auditors as well for ISO 45001. And we help companies or we help businesses build a strong, sustainable safety culture. That's why during all my slides, I use the word sustainable. A plan should not be as good as the person making that plan. If that person is not available, who's the other person doing it? So these are the things you need to factor in. And Fatima, I do see two questions. And they one says, please clarify, kitchen staff are required to wear both masks and face shields.
Yes, and yeah, it really is a hot topic. It's a hot topic on many levels because of work environment, but worker safety, and we're suffering from a cook shortage. So you combine all three of those elements, and they certainly don't make for a good mix. The feedback that we did receive from one of the last 4S webinars that we held with the Chief Prevention Officer and the Ministry of Labor was that if the kitchen staff is not able to keep 6 feet apart, then they are required to wear the face shield. And that is a requirement pretty much, I think, across the board on all of the public health units because of, Addy, to your point with the variant and the droplets area. So yes, it is. And
Fatima, sorry to interrupt. We are already on 10:35. I do see 33 participants and I respect their time as well. So what do you think, given that there are so many participants still there, we are very much here for next 5 minutes or so. We are game.
Absolutely.
Because This is getting really, really good and highly engaging. Please ask your questions. We don't mind staying here for another 5 or maybe even 10 minutes if you have questions and if you want to engage with us and ask. This is a good time
Yeah,
for us to do it. Yeah.
great time. Thank you, Addy. And I appreciate everyone staying. I had mentioned that maybe everyone needed to go. So please keep your questions. We're happy to stay on. I think what I'll do, Addy, is when I send the email out with the recording and the slide deck and all the documents, I think I will also include the PPE information for everyone. I think that is needed, as well as another hotel that stated that, would you be able to call me as well? So my hotel knows how to handle the yes guests as well. And I think the question here is, when someone says that they have been exposed, how do they handle these situations? But
Fatima,
now a note on that is the contact tracing is only required for the restaurants. And sorry, Addy, you were saying?
yes, yes, sorry. There was a very interesting question that I wanted to pick. The question was on whether servers should be wearing a face shield. And it boils down to what your health and safety objective is. I would like to answer that as a health and safety partner. It all boils down to what your health and safety goal is. It's just to basically comply and just take care of the basic obligation, or whether it's to build a health and safety culture and build a brand image of a safety conscious customer. Obviously, your servers will get less than 6 meters, less than 6 feet apart when they go closer to this to the table, to the guests to take their orders, right? So they have to wear a mask. That's for sure, and a safety glass, which is a requirement under the ROA. As I said, if you're open under the ROA, you require a health and safety plan. But because of the droplets issue and because of the variants, that's the unfortunate addition. But it's again for your staff safety and for safety of the guests and the safety of the community at large. We don't want another wave, right? So we want to ensure what we want to do everything we can all together as one to support. So that's the question I wanted to take. Sorry, Fatima. Please go on.
No, thank you. We want to look after Anna. Anna is a valued member, and it's good to see you on the screen, Anna. So thank you for joining us.
I'm so happy to see 27 members still waiting for here and listening to us, and it tells me that they're all safety conscious employers, and I'm so proud to see all these members here, Fatima, because safety is a competitive advantage, Fatima. It's a paradigm shift.
Especially in this environment, right? Like when you're trying to find your point of difference, adding comfort to a customer experience is king. And when folks and customers can see that we're taking extra health and safety measures, there's a level of comfort of going into the establishment or experiencing their services. So you're absolutely right. Now, before it was service is king, but I think health and safety is right up there as well.
Absolutely. I would say safety is your competitive advantage. That's the paradigm shift from safety was a requirement to remain in business earlier. So from that, people have shifted, and that's 25 people waiting in this webinar, even 5 minutes or 10 minutes past the 10:30 mark. Kudos to them. And I'm so proud to be part of such a webinar where people respect health and safety the way it should be, because it's all about staying safe and keeping your workers safe and keeping the guests safe and the community safe. Simple as that. So do we have any further questions, Fatima? Or can we call it a wrap? Or
I think we may rally it up. The questions have all been answered. With all the links and the slide deck, the document, the Word document, and the recording, we will certainly email to everyone. I will also include information on PPE and the contact tracing. And to both Vanessa and Angela, I will give you a call this morning back. And to all of you and to everyone in front of the screen for 4S and behind the 4S screen, thank you for today's session. You certainly have been professional and a wealth of information and knowledge. So thank you to 4S, and to all of you. Thank you for all that you do and for being true champions to hospitality and for joining us. We do hope today's session has been helpful. We hope to see you again soon, and we will be rallying up another health and safety webinar to come to you. So if you have any ideas of what you'd like, certainly let us know. Send us an email at info@orhma.com, info@orhma.com, and we're happy to bring another session to you of a health and safety topic. So until then, as they say, stay safe, stay positive, and test negative. So stay well and have a good day.
And stay sane. Stay
And
safe.
stay
Stay
sane.
sane. Mental health is crucial, everyone. Okay, and let's all have a rollicking time. I'm so happy Ontario is back on its feet. Let's keep it like that. Bye-bye.
Bye-bye. Enjoy your day.